health officials in the Western Cape are escalating their efforts to try and get people vaccinated in the province. And that's after the detection of a new subvariant of coronavirus about 2 weeks ago. Authorities have reiterated that the emergence of the subvariant isn't cause for panic. Natalie Malgas is part of our team watching the story. She's live to us now from Cape Town. And Natalie, it's important, of course, that we touch base specifically where you're at, because that, in fact, the Western Cape, is where this case was found.
That's right, Ayanda. In fact, late December, on the 27th of December, a patient walked into a testing site. That sample was sent to the genomic surveillance unit at Stellenbosch University, and around the 6th or 7th of January, it was announced that this subvariant of Omicron has been detected in that random set of samples that the experts at Stellenbosch University have been testing, which is part of the reason why provincial health authorities are now stepping up wastewater surveillance and vaccinations as part of their strategy. Come what may in the new year, they believe they've got all the necessary parts in place to protect residents, visitors and citizens here of the Western Cape. In fact, I'm joined by the Western Cape Health COO, Dr. Sadiq Karim, to give us a quick sketch of just what we're dealing with in the Western Cape. This new subvariant, Doc, is it something that we should be at least cautious about, if not panicked?
Sure. Yeah, so XBB.1.5 is a subvariant of XBB and has been found in around 38 countries globally, notably in the USA, in the UK and Denmark. In fact, in the USA, that proportion of sequences is 82% of the cases worldwide. But I think why it's caused such concern globally is because of its increased transmissibility. So it's been noted in the USA that it's the fastest growing variant of all the Omicron subvariants that they found to date. And in fact, the CDC now cast estimates that it could be, in fact, as high as 43% of the cases. So it's definitely going to become the dominant variant in the USA. And because of its increased growth advantage, that's been the cause for concern.
In the Western Cape, what are we looking at in terms of the number of active cases, hospitalizations, and unfortunately, fatalities?
Sure. So we monitor this very carefully on a daily basis. At the moment, currently, we have 531 active cases in the province, and we have 23 people who've been hospitalized with COVID. That's public and private sector. So we've not, in fact, seen an increase in recent weeks in our cases. Not even in the hospitalizations, and certainly not an increase in the deaths recorded in the province.
The strategy going forward, we know this is a subvariant of Omicron. We're hearing from the experts this was expected. There are something like 100 of these subvariants out there. What is the strategy to protect residents, and why are you doubling down on the vaccination strategy?
So I think that's quite important. Our strategy, in a sense, has always been proven to work for us in the Western Cape and worked very well for us. So we obviously have a very active surveillance team, and so we'll be doing our surveillance, we'll be doing our monitoring, we'll be doing the testing as well. And then obviously vaccination remains the bedrock of the strategy right across the world, in fact. And so we're doubling down on the vaccination in the province. To give you some idea of the vaccination in the province at the moment, currently, about 54% of the population older than 12 years in the Western Cape have had at least one dose, and just about 58% of the adults have been vaccinated with at least one dose. But obviously, we'd like to increase this significantly over the coming weeks, and that's been part of our strategy.
Since the beginning of the vaccination campaign in the Western Cape, a lot was said about hesitancy and skepticism. There were some corners of the province that were hell-bent against the vaccine. What does that look like now in the new year and with the new awareness campaigns that you are rolling out as the department?
So there's still some hesitancy amongst people, and that's been right throughout this vaccination campaign that we've found, and for various reasons. You know, people are skeptical about the vaccine, for example, but that's part of the strategy that we're still trying to combat. So we're rolling out our vaccine taxi right across the province, for example. We're taking it to various sites. In fact, because it's summer, because it's Cape Town, we're taking the vaccine taxi to our beaches, for example. And so that's part of our strategy, and also obviously an increased awareness around the benefits of vaccination, which remain there. You know, it still helps prevent severe illness and deaths.
Should we not catch these mobile units that, as you say, is making the rounds across the province. Where else can people go? Are private sites still available? We know some university campuses were converted, some private pharmacies were running vaccinations. Do we have enough stock? We've heard from some retailers stock is running low. Where can one go to get this vaccine?
So we have enough sites in the Western Cape. We have just about 220 public health sites, and those are listed on our website, so people can go to the website and find out where they can get the vaccination. Most of the private sector vaccine sites have closed down due to the lower demand. At the moment, we currently vaccinate roughly about 2,300 people per week in the Western Cape province, but still people can get their vaccination at our public sector facilities. As I said, there are about 220 around the province, and we really want to encourage people to come for the vaccination and also to come for the boosters if they obviously qualify for the booster.
Dr. Karim, just lastly on that note, a lot was said about particularly older patients and those with comorbidities, the encouraging them to come forward to get their booster shots and get vaccinated. Should we be concerned if we started with J&J? Should we be sticking with some brand of vaccine, or can we mix up this cocktail now?
So absolutely, and I think we'd encourage people to mix them up. It's called heterologous boosting. So for example, by that we mean if you've had the J&J initial dose, you could, when you have the second one, have the Pfizer, for example. And that's also useful and important because these vaccines work differently in the body. And heterologous boosting and heterologous vaccination is, in fact, I would recommend that that's actually the better option.
Thank you so much, Shay. And Dr. Sadiq Karim there of the Western Cape Health Department, again just saying it was unsurprising that the subvariant emerged on the horizon, but because it's still part of the Omicron family, they pretty much have the necessary tools in place to stick with the strategy in combating whatever may come in the new year.
An absolutely important story. Natalie Malgas, thanks very much indeed for breaking it all down for us. Natalie's live to us there from Cape Town.